I guess my transplant story started clear back in 1978. When I was pregnant with my oldest daughter, I had symptoms of ulcerative colitis. And the doctors had no idea. They couldn't do anything because I was pregnant, so they couldn't do any kind of diagnosing. When she was about 7 months old, I was put into the hospital and ended up being there for about 2 weeks, or close to 2 months, excuse me, and had part of my colon removed. It was completely filled with polyps, and had flare-ups after that for quite a bit, quite frequently, and was treated with steroids and sulfasalazide or something, some sulfa drug. And then it got pretty quiet. I was fine. Fast forward several years, 1999, ended up having some kidney problems. Just acute pain, ended up having my left kidney removed with tumors. So that wasn't anything to do with my transplant story, but it's getting there. And then in 2000, I started getting really, really itchy. My feet would itch, I'd get hives, and I thought I had an allergy or something. So I went to the doctor and he said, well, one of your liver functions isn't right. So I went and had an ERCP done. And the doctor said, well, that he was looking for a cousin of ulcerative colitis, which was PSC, primary sclerosing cholangitis, and was diagnosed with that. Ended up being put on the transplant team in 2000, or transplant list in 2000, when the transplant center was up at LDS Hospital. And 6 years later, ended up with breast cancer. And after being told that it had metastasized to my liver, I called the transplant office at LDS Hospital and just told them that I couldn't be on the list because if it was cancerous, they wouldn't transplant me. So they treated me for my breast cancer with different drugs, and I was on those for quite a while. And they were monitoring my numbers and things like that. But when my liver numbers started acting up, they took me off of it. And I asked the doctor at that time, I said, could it be my PSC? And he said, I don't know, I'll have to check. And so he did some checking and he called me back and said he thought it was my PSC. And I ended up going in for another colonoscopy and an ERCP. And the doctor at that time told me I needed to contact the transplant team again. I don't think that the breast cancer had metastasized or I wouldn't be here today. I think it was just the liver disease that was manifesting itself again. So I was hospitalized for a little bit. In 2015, I was again listed on the transplant list. And just kind of kept quiet for a while, and then that year in August or so. Anyway, between 2006, when I had gone off the transplant list and then came back on, I had been in the hospital a few times and had several ERCPs done to try and keep my bile ducts open. And ended up in the hospital in August of 2015. And I had had a biliary drain placed because the bile ducts kept on blocking, and it was so uncomfortable and it wasn't working right. So I had lost a lot of weight, couldn't eat, would throw up, got really dehydrated and was put in the hospital, like I said, in August with acute renal failure as well. And at that point, my MELD score was 25. And my MELD score generally stays really stable between 8 and 12, which is not bad. But with the PSC, that's pretty common. So anyway, this year, or in 2017, I just started having really bad problems. The end of August, and I remember these dates because of other things that were going on in my life at the same time. The end of August, I had a blood infection. So I had gone to have my blood drawn, and then I ended up coming up to the hospital to stay for a few days and have IV therapy to try and clear out that infection. Went back home, went back to work. Everything seemed okay till the end of October. And then I had called the clinic and just said, I'm just not feeling right. So I was going to stop and have blood drawn on the way home, but the American Fork Hospital hadn't gotten the orders, so they drew blood, but wasn't the test that needed to be done. Anyway, so the next day, I had taken the day off because I just really just couldn't. So I was going to go get blood drawn that morning also. Was getting ready to have blood drawn and went to the bathroom, or getting ready to go have blood drawn, went to the bathroom and had black stool, and then I started throwing up blood. And I was really scared. My husband was out running, and I called him and I said, we need to go to the ER. And he said, why, what's going on? And I told him. In the meantime, I'm getting ready to come to the ER and come up here, and they said, well, we have to do a couple tests to make sure that this is what's going on. And it ended up being a Dieulafoy's lesion, which is the bleed in my esophagus. And so Dr. Gilroy went in and banded the spot there, and I was scheduled to go back in a couple weeks to have it tattooed so that when I had another ERCP, or when I had the transplant, that they could fix the varices. And he found 4 more places that he needed to band at that time, and I ended up not, when I had my next ERCP, the doctor was going to tattoo them, and he couldn't even find where they were. So didn't end up having it tattooed. Then the first part of November, about a week and a half into November, just acute pain in my lower back, right side, and up on my lung. I was just miserable, and I had already made arrangements to have a substitute at work, and I went and talked to, I teach school, so went and talked to the principal and just said, I need to take about 10 days off to get this taken care of. Ended up being admitted to the hospital on November 14th and had a drain put on my lung and in my abdomen to try and drain fluid off. November 22nd, the night before Thanksgiving, I got to go home, and my husband, we were having Thanksgiving at our house, and my husband really did an amazing job, you know, between 12 kids and their spouses and 36 grandkids at the time. No, okay, 35 at that time. He did an amazing job. In the meantime, he's out trying to find medication for me to take because my insurance wouldn't cover what the transplant team had said I needed to have. So they were going to find a substitute for it. And then the problem was finding a pharmacy that was open on Thanksgiving Day, which we did. Anyway, so long story short, that turned out great. Went back a few days later, like I think like the 28th or something of November, and was put back in the hospital for the same thing. And ended up going, well, both times home on IVs and pump. I had a port from my cancer treatments. And finally, you know, because my MELD score wasn't changing, it was also always stable because that's PSC. And with the complications and the hospitalizations that I had had, Dr. Gilroy and my transplant coordinator pleaded the case and got exception points so that my MELD score increased to a 31. And I got the backup calls at the first part of January, and I thought, okay, everything's good. And then I didn't get anything and was really pretty worried about it. So I called my transplant coordinator and said, am I missing something? Am I supposed to be doing something? And he said, no, just be patient. And February 8th, got a phone call. I was talking on the phone to my daughter. We were going to go to Chekarama for a granddaughter's birthday. And Craig called and he said, well, we've had an offer and you need to be ready. So NPO, and this is going to move pretty quickly if it's the case. He said, I'll call you back. So I let my daughter know that we wouldn't be going to Chekarama because I couldn't eat. And within about 5 minutes, Craig called back and he said, go up to the hospital, drive safely, let me know when you get there. So we did, and by 8 o'clock that evening, I was in surgery. I remember I wasn't nervous coming up because I had had surgeries before. I told my husband, I said, I know it's going to hurt, but I also know I will feel better afterwards. And February 8th, had the surgery, was in intensive care just 2 nights, went up to the transplant floor and went home on February 15th. Went back because blood draw showed that my white blood cell count was high. Went back for IVs and had the same infection back. Anyway, I'm doing really well now. I'm so grateful for my donor and have thought about them a lot. But so thankful that I got the gift of life. Thank you.